Welcome to the T. Allen Haynes Radio Show. Conversations with elite business leaders from around the world. And now, here is your host, T. Allen Haynes.
Welcome to the show, Clark.
Oh, Alan, thank you very much for having me on. I appreciate the opportunity.
Oh, absolutely. And congratulations on all your accomplishments. You've really done some great things. So thanks for being on the show. So let's just get right into it. Tell us about the types of people that you're helping and what you're doing.
Well, currently I'm the medical director at the North Carolina Physicians Health Program, and we assist different kinds of providers, which include physicians, physician assistants, pharmacists, pharm techs, veterinarians, and vet techs. So we assist them with any kind of issue they may be facing, which puts either their practice or their license or their health or the patient's safety in jeopardy. So as you might imagine, we see a lot of folks with chemical dependence of some sort or another, alcoholism, mental health issues, cognitive problems, or other self-destructive behaviors. And we try to figure out what's going on, how we can best help them, and then get them treated if they need it, monitor them if they need it, and then get them back to doing what they do best, which is taking care of patients.
Perfect. So you've kind of broken off a little bit and kind of, I guess the correct word is specialized. Tell us a little bit about that, how you're helping others in that arena.
Well, in 2009, I was a family practitioner, family medicine doctor in North Carolina for 24 years. But in my 17th year of practice, I went to my practice partner, this was in 2009, and said, look, if something doesn't happen, I'm going to have to leave the practice of medicine. What was once something that I cared very much about, had a lot of energy for, a lot of passion for, a lot of idealism, and that was the practice of medicine. It had turned into something that was dreaded. Medicine became drudgery and dread, and I was no longer getting the satisfaction that I once felt in practicing medicine. I felt exhausted all the time. I developed a lot of negative feelings about what I did and the people that I served. I began to detach from patients. I could feel that happening, and I felt like I wasn't accomplishing anything. And he said, well, do whatever you need to do, just don't leave. We had a busy practice, and quite frankly, I wasn't ready to leave medicine. What I wanted to do was find out what was wrong and fix it. I really didn't know what was wrong. But I took some time off, shortened my call. I went to 3 days a week instead of 5, so it meant a cut in salary, but at that point I didn't care. I would have paid somebody to make me feel better, so I paid myself by taking some time and giving myself some space to figure things out. I started exercising more, getting adequate rest, reading outside of medicine. In other words, I started doing all the things we ask our patients to do, but sometimes we ourselves don't do them as providers. And so, and within weeks, I began to feel better. And at that same time, I was doing a lot of searching on the internet, and I came to the conclusion that I had burned out. I was suffering from professional job related burnout. And that really set me on a path to discover why it happened, what the underlying causes were, and what could be done about it. And I began reading on this subject, everything I could find. And I began to tell my story, and somebody asked me to come do a talk, and I did that, and it was well received. And I began to wonder if my colleagues were suffering, and it turns out that some of the highest burnout rates in any profession right now are in medicine. And in fact, burnout rates approach 70% in some specialties, and that's not good, because we're losing a lot of providers who are getting out of medicine early. They're retiring. They're turning, because they feel so bad being burned out, they're trying to make themselves feel better, and they start dabbling with drugs or alcohol, and they get in trouble there. So it's a big mess, and I've devoted probably the last 8 years of my life to dealing with this issue. And in fact, in April of 2016, I left clinical medicine to take my current role to work with the North Carolina Physicians Health Program, because we're seeing the effects of a lot of provider burnout. They come in here with all sorts of issues, and when you dig down and get to the underlying cause, it's because they're suffering from the immense dissatisfaction and sense of hopelessness and helplessness that burnout can cause.
Man, that's amazing. Congratulations on you having the courage to identify that and take action. Do you feel like the people in the medical industry, are they doomed for that? I mean, how can they combat that?
Well, there's, as it turns out, there's a detectable burnout rate in any profession. It's just that some professions are higher than others. Anytime there's a high velocity or high production value and a high stress environment with high emotional impact, that's where you see burnout rates are the highest. So it's not only healthcare providers, it's other people like teachers, lawyers, social workers, police officers, firefighters, dentists. So there are a lot of professions that report high burnout rates. Other professions, there are very low burnout rates, but it just so happens that some of the highest rates right now are in medicine, and those include physicians, physician's assistants, family nurse practitioners, nurses, ancillary service providers. And the reason is the transition we've seen over the last couple of decades to a calling to something that's more of a business. You know, we talk about the business of medicine, and it's really the healthcare delivery system that's causing all the burnout. It turns out that only about 10% of the time will an individual burn themselves out. 90% of the time, it's caused by the work environment.
Right.
And there are 6 major underlying causes of burnout, and they are work overload, lack of control, insufficient reward, breakdown of community, absence of fairness, and conflicting values. And wherever you see those 6 domains negatively impacted, you'll find a toxic work environment, and you will find people burning out all over the place.
I mean, it's almost like a badge of courage where, these doctors and these interns, it's expected of them to work these long hours. I mean, that doesn't make any sense.
It really is. And even if you look at the way physicians are trained in residency, it's almost inculcated in the beginning that your needs come way down the list, that the patient's needs, of course, are first. And if you're sick, you suck it up. You come in and you work. I mean, that's ridiculous. We wouldn't tell our patients to do that. If they're sick, we say, you should probably stay home for a few days and wait till you get better and then go back to work. But with providers, it's just the opposite. And we're kind of hung or hamstrung by our profession in that we want to help people. We want to be useful. We want to alleviate pain and suffering wherever we can. So when somebody says, can you see this one more patient? Or can you help with this one more problem? We hate to say no because we're kind of in that business of trying to solve people's problems and trying to alleviate pain and suffering. But a lot of the times we don't have, providers by and large, a lot of people are, they take care of everybody around them, but they don't take adequate care of themselves. And so if part of your life is unbalanced and you don't have a way to offload the stressors that occur during the everyday practice of medicine or whatever you do, whatever profession you're in, if your life's out of balance, you don't have a way to deal with those stressors, then it puts you at risk for burnout. But sometimes even if you do, if your work environment is so bad that it doesn't matter. I mean, you can take a passionate, purpose-driven person that's high on resilience and hardiness, and if you drop them in a toxic work environment, you will burn them out. People will burn out at different rates, but you will still burn them out over time. And so the challenge is recognizing that's what's happening. And I went over the symptoms a moment ago because I had all 3 of them. There are 3 major symptoms: emotional exhaustion, where you feel like you can't give of yourself on an emotional or psychological level anymore to the people you serve or the people you work with. The second one is depersonalization. That's when you become cynical and you start to detach from or separate from what you do and the people you serve. And the last one is a lack of a sense of personal accomplishment, where you feel like nothing you do anymore makes any difference, and you're no longer getting the personal satisfaction that you once did from the job that you do. And so recognizing that's what's happening and realizing that, look, if I didn't burn myself out and it's my work environment, and if I can't change my work environment, then it might be time to find a different work environment. Because I tell you, life's too short to labor away in a job you hate and detest. And what people can do it, but what happens is they end up bitter and angry and resentful because they feel like life didn't give them what they felt they should get or what they deserved. And yet they were in control all along. And so my message to folks is, if you feel you're burned out and you can't change your work environment, and this is something I cover in my book. I actually wrote a book about burnout called REIGNITE. Then you have to really take stock and figure out, is this really how I want to live my life, feeling like I do in this job I hate and detest? Why not use my natural talents and abilities in a place that not only accepts them, but rewards them and strengthens them and sharpens them rather than chips away at them?
Of course, the media and television is not helping either.
No, and that's something else I talk about in my book, is that you got to surround yourself with positive, energetic, optimistic people. And you can't find that on the news anywhere these days. And so I, by and large, get my news from several trusted sources online. I do not watch TV. That thing will make you stupid. It turns out most successful people read 20 to 30 books a year. And because there's a lot of wisdom that's already out there, a lot of people have already solved the big problems, and the knowledge is laying in libraries all across the country. You just need to start opening some books and reading. Life should be a continuous learning process. It is anyway, but you can augment that by searching for knowledge and tools that you need to help you do what you want to do and help you do it better.
Speaking of books, is there one book that's really stood out along the way that's inspired you?
Yeah, I like, I keep recommending this book a lot to people because I see it, not only when I read it, not only could I identify with it and it resonated with me, I see people do it all the time, and it's called The Big Leap by Gay Hendricks. And in that book, he talks about people's upper limit challenge. People will often succeed, and they will have one success after another up to a point where they feel like any continued success is no longer deserved, and so they will self-sabotage, and they will end up losing ground or losing things that they've been successful at getting because they've hit this upper limit challenge. He also talks about working in your zone of excellence versus your zone of genius. A lot of people stay in jobs they hate because they know they're good at them. Well, that may be your zone of excellence, but is it your zone of genius? Maybe you would be better served, not only better serving yourself, but better serve people if you were in a different arena altogether, or if you became an entrepreneur, if you quit that 9-to-5 job and really pursued your passion, maybe that's your zone of genius. And so it's something, folks need to critically think about.
Excellent. Thanks for sharing that book title with us. So, talk about what drives you, gives you the passion to do what you're doing.
Well, I think it's, I don't know, I've been fortunate in that at my current role, I'm pulling on a lot of different threads. As I say, I was a family physician for 24 years, and one day someone asked me, actually it was Dan Miller who wrote the book, 48 Days to the Work You Love. He asked me, he said, "You must love medicine. All that you've done and all the success you've had in medicine, you must really love it." And my answer really took him aback. I said, "Dan, I had been in medicine for, at that time, I think 20 years, and I use lots of exam gloves, and I've tried on rubber gloves and nitrile gloves and latex gloves and PVC gloves, half sizes, whole sizes, sometimes even quarter sizes. And I have never put on a pair of gloves I felt fit my hands perfectly. And that's exactly how I felt in medicine for the last 20 years. I felt like either I didn't fit it perfectly or medicine didn't fit me perfectly. And now that's not to say I wasn't good at it. I feel I took great care of my patients. I was Family Physician of the Year in my state in 2002. But somehow I always felt like this wasn't what I was meant to do. When I left clinical medicine and burned out a second time and left clinical medicine in April of 2016 and took this job that I'm currently in, I now feel like I'm exactly where I'm supposed to be. I'm in my lane. I'm pulling on a lot of threads from my past that are serving people in a different way, and I'm still using my medical background. So I feel like I'm in my zone of excellence. I mean, I'm out of my zone of excellence and in my zone of genius, if you want to call it that. And so that's why I think I'm passionate about what I'm currently doing, because I feel like it's what I was preparing for all those years in medicine.
Awesome. Thanks for sharing that with us. So let's get right to the heart of the problem. What are you finding to be the biggest misconception of somebody that's experiencing burnout?
Well, most people and most organizations, in fact, when they feel like there's a lot of burnout in their employee pool or their turnover is real high, they bring in a bunch of stress managers, stress experts, because they feel like, well, everybody must be overly stressed. And so the focus becomes the individual. It's like, surely you don't have the tools to make yourself better, so we're going to teach you. And so it's kind of demeaning in a way. And given that 90% of burnout is caused by the work environment, you're trying to teach somebody how to overcome something they didn't cause and are ill-equipped to fix. So the focus has to shift from the individual to the structural changes that need to occur in systems and work environments to get rid of, to mitigate, alleviate, or eliminate this thing we call job-related burnout. Since the individual didn't cause it and can't fix it, it's up to the organizations to change in a way to reduce the underlying causes of burnout in order to alleviate it. And it gets back to those things I was talking about a moment ago, the lack of control, the work overload, the absence of fairness, conflicting values, insufficient reward, breakdown of community, all those things cause burnout. And it's because companies do this, usually that starts out as cost-cutting measures. So they eliminate employees. Well, the work has to be done by somebody, so whoever's left behind, it gets set on their desk. And after a while, it's like you reach a point of diminishing return. You can, if you're riding a racehorse and you're whipping that horse to go faster, at some point it's going as fast as it can go. And so you can whip it all you want, and it's not going to go any faster. And in fact, if you continue whipping it, it's going to start slowing down. and so everybody's stressed to the max in terms of what they can do on the job in most situations. And putting extra workload on them is not the solution for increased output, at least output that's good. And so my biggest challenge is trying, when I talk to organizations and companies and big hospital systems or big provider groups, is to get them to understand that if they attack these underlying issues of burnout and eliminate them, it's not going to cost them money. They're going to save money. And not only are they going to save money, it's income generating, because you get a happier work environment, you get less customer complaints, less employee complaints, less absenteeism, you get higher production rates and a product that's of a better quality. You also get less turnover, and employee turnover is very expensive. So all of those things, add back to the bottom line. And so if they spend some money on wellness programs and workplace redesign, it's money well spent.
Absolutely. So it seems, America is the greatest country in the world, but it seems like some of these other countries have figured it out. What's What's holding us back?
Well, you would think so, but and I'll tell you where burnout rates right now are screaming high, and some places higher in Germany than they are here. And you think, well, wait a minute. In Germany, they get 3 months off a year, and they work, I think, on average 3 hours less than Americans work in a work week. I think they work like 31 hours or something like that in a work week, and they get 3 months off a year. Why are they experiencing burnout? Well, the reason is when they are at work, they are micromanaged. Everything they do is being followed and criticized because, German engineering is world-renowned. Well, it comes at a price. The price is they're burning out their employees because they're overly micromanaged. So it's not just here, it's other countries too, and other countries in medicine like England, in fact, any system where you find where medicine, there's a single payer or medicine is socialized, they've got even higher burnout rates than we do because the provider has absolutely no control over their day and how it looks and what problems they're able to handle and what resources they can bring to bear on behalf of the patient. All of that's controlled by some centralized agency. And so the problem gets even worse. We have to get back, at least in medicine, we have to get back to a place where we're willing to give the provider more autonomy in the doctor-patient relationship. And that was one thing that really drove me away finally, was the conflicting values. Toward the end of my clinical practice, I felt like every day I went to work I was violating my oath because our first charge is to do no harm. And yet payers were inserting themselves between me and the patient and front-running medical decisions without my permission or without the patient's permission. And it was very dispiriting. And in fact, I was billing under a provider number and collecting a fee. And so I was at least duplicitous, and I was taking part in this whole dysfunctional system. And it was very demoralizing. And so the happiest doctors practicing today are those who are not practicing under the traditional payer system. They've actually contracted directly with the patient, and their fees are much lower. The patients are happier because they get more time with the doctor. Mm-hmm. And the doctor is certainly happier because he gets to practice medicine in a way that's he feels benefits the patient the most and is the most personally satisfying to the provider.
Can you share with us a case study of where you've helped someone overcome this challenge?
Well, I guess the best place would be to go read some of the reviews at my book. Are you talking about, in general, case studies about burnout and how to solve it? Is that your question? Yeah. Somebody you've actually helped, possibly, or helped consult. Well, everybody who comes here is confidential, so I can't really talk about individual providers. But I will tell you that every week we get a provider come to us that says either outright, "I'm burned out and I don't know what to do. I'm thinking about leaving medicine." We've had people who are so depressed they were suicidal. Then we have people who come in with chemical dependence issues. They've either started drinking too much, or they're using opioids or some other mood-altering substance. And it started out innocently. They were just trying to make themselves feel better, but then somewhere along the line, they crossed the line and became an addict. And when you really get a good history from them, you find out it was because they were burned out. They were feeling so bad that they turned to alcohol. It starts out like relief drinking. I need this glass of wine to relax in the evening or to help me get to sleep. And then after a while, the one glass doesn't do it anymore because, like any drug, people accommodate to it and it loses its effectiveness. And so one glass becomes two, and eventually two glasses become three, and three becomes a bottle. And, nobody wakes up and says, with the notion that they're going to ruin their life and become an addict. It happens very innocently, but that's how it happens. Mm-hmm. And so people come in with that story where they didn't intend things getting out of control, but that's kind of where they ended up. But it all started out because they were disenchanted with how they were trained and their notion of what medicine was going to be, and then there was the reality of what medicine has become, and it was just too much for them, and they began to suffer, at least mentally. And that's, again, the big difference between stress and burnout is with stress, the damage is primarily physical. With burnout, the damage is primarily emotional, and it gives people a sense of hopelessness and helplessness, which are two major symptoms of depression. And that's why we see higher rates of depression in people who are burned out versus people who are overly stressed. And the depression is so bad in medicine, over 400 physicians committed suicide last year in the U.S. It is the highest risk profession for suicide in America today, is being a physician. And that's more than one a day, and that's tragic because we need our providers. We need a healthy healthcare provider workforce to take care of us. But it's the very system that they're working within that's creating this problem.
So one of our listeners might be experiencing something like this. What would be your best piece of advice for them?
Well, know that it doesn't have to be this way. You do not have to suffer from burnout the rest of your life. Know that at least 90% of the time you did not cause it, but also bring to the table a willingness to consider a change. And sometimes that means maybe changing work environments. Now, I'll tell you what happens when people are faced with this choice. Do I stay here in this place I hate to work, or this job I hate? Do I stay here, or do I find something else or someplace else to work? And I will tell you that the burned out mindset tries to keep people where they are. The burned out mindset says to the individual, it's too late for me. I'm too old now to change. I don't have the right skill set. I won't make as much money somewhere else. They keep putting all these roadblocks in front of themselves, and all of that's occurring up in their head, and none of it is true. You can find meaningful work for yourself utilizing all your natural talents and abilities in a way that's satisfying to you and the people you serve. You just have to go out and find it. And I go over all this in my book, REIGNITE.
Excellent. The listener is ready to find out more about how you could possibly help them, or more information. What would be the best way for them to do that?
Well, you can go to clarkgaither.com, and I blog about professional job related burnout on that website. There's a landing page for my book, REIGNITE. It's reignitebook.com. There's some information there, and you can buy the book anywhere books are sold, not only in retail stores, but online outlets as well. And if you're in North Carolina and listening, the North Carolina Physicians Health Program has a website. It's ncphp.org, where I'm the medical director. And if you're a provider in North Carolina and you're having difficulties, or if you know of a colleague who's suffering, you can come in or make a report anonymously. And we've had over 4,000 providers through our doors in the last 28 years, and so we're here to help folks.
Excellent. Well, it was a great information. I really appreciate you spending the time with us, and all that information will be down below in the show notes. So thank you very much, Dr. Clark.
Well, listen, thank you so much for letting me share.
You're welcome. So there you have it for this edition of the show. We'll see you.
Thanks for listening to the T. Allen Haynes Radio Show with T. Allen Haynes. Conversations with elite business leaders from around the world. We will see you next time on the T. Allen Haynes Radio Show.